Picture a leader in your mind, a leader in health. It could be within a health service, within a university. It could be in the UK. It could be anywhere. What do you see? So here are some leaders in the UK. This is Matt Hancock, our Minister for Health. This is Simon Stevens, our Chief Executive of our National Health Service. And patterns of white male leadership do predominate in many institutions in the UK, including where I work at the Liverpool School of Tropical Medicine. We have 38 professors. The majority are white men. Less than a quarter are women. And we don't have any women from a black and minority ethnic background at that professorial level. So I've been working at Liverpool School of Tropical Medicine for 20 years. Wow. And I want to tell you about my journey in that process. I've been working on research on health system strengthening in collaboration with ministries of health, with NGOs, non-governmental organizations, and with communities across Africa and Asia. It's been a real amazing experience and journey. And I've learned a lot about leadership. And I want to argue that leadership is a bit more colorful. Leadership happens at all different levels. You don't have to head up an institution to be a leader in global health. And leadership is diverse, and in global health, it's frequently female. And here are some of the leaders that I've had the privilege and the opportunity to work with over the last 20 years. And what I want to do is to introduce you to 3 of them and say, what have I learned from them? What qualities of leadership do they embody that can equip us for this complex world of global health? So first up, this is Najla Al-Samboli. She did her PhD with us at the Liverpool School of Tropical Medicine. After that, we held research grants together, working on tuberculosis and active case finding. And Najla is a pediatrician at Al Sabin Hospital in Sana'a in Yemen. And to me, she embodies courageous, compassionate, and resilient leadership. So Yemen has endured 1,703 days of war. And war is one sure way to undermine health and health indicators, and to destroy health systems. And in fact, once the war started, we weren't able to attract further research grants. Since the war began, 85,000 children have died in Yemen. According to the latest census in the UK, that's more than all the children in Liverpool. 24 million Yemenis are in need of direct aid. That is the equivalent to 35% of the population of the UK. Najla had the opportunity to leave Yemen when the war started. Some of her colleagues did. She didn't. She stayed. She stayed driven by love and compassion for children. And this is what she said in an interview last year. She says, each day when you leave home, you don't know if you will be back home or not. It's a challenge. It's a risk, traveling to work, working. But when I see how sick people come to the hospital, despite all the security challenges, this makes me strong enough to go to the hospital to help them and stand by them. To be a good leader, you have to lead by example. You have to become a symbol. So Najla, to me, is a symbol of this courageous, resourceful, resilient leadership. And this story links to another leadership quality at the community level of solidarity in a city that embodies it, Liverpool. And what we've had in Liverpool is staff at Liverpool School of Tropical Medicine, people in the Liverpool community fundraising in solidarity with NAJLA and other health workers to support this hospital. So we've had over 100 artists donate work to raise money. Every month, there's a stall in Granby Street, 2 miles that way, run by Liverpool women called Habibiti, which means beloved in Arabic. There's Yemeni Scousers, Somali Scousers, Pakistani Scousers coming together selling pre-loved goods. And the monies go to support and in solidarity with Yemeni health workers who have not been paid since the beginning of the war. So this takes me to my next leader I want to introduce you to, because it's also about leadership at the community level. And my research is, I'm a qualitative researcher. We use qualitative methods, participatory methods, which means that we talk to people, we understand their experiences, the challenges that they face, and look at ways to try and respond to their health needs. So this is Ezra. She's from Ethiopia, and she's one of the 38,000 female community health workers in Ethiopia. And there are many women and men like her across Africa and Asia. And they work with the communities they come from. And they are trained in basic health and support, and they act as a critical bridge between poor, neglected, marginalized communities and health systems. They are the ones encouraging and supporting women to deliver in health centers. They're the ones supporting patients to adhere to the challenging TB drugs we heard about earlier. They are the ones identifying symptoms of malaria. They are the ones handing out preventative drugs for neglected tropical diseases. They are leaders in their communities, leaders in health. And we also see a lot of leadership within households, women, often girls, caring for people at the household level and people who are sick. And this quote is just to give you a sense of the scale of that. But so much of this healthcare delivery and this leadership is under-recognized, undervalued, under-supported, and often unremunerated. So these are my third colleagues I want to introduce you to. So this is Jane Waritu and Joseph Kamani. I work with them on a research grant that we started this year called Arise, which is about health, accountability, and well-being in the fast-growing informal urban settlements across Africa and Asia. And they link to a group called Slum and Shack Dwellers International, SDI. And SDI is a federation of people living in slums across Africa and Asia, across 38 different countries. And they link together and share experiences. So it's an incredible example of a network for learning. So to me, this embodies the idea of facilitative leadership for dialogue, for negotiation, for voice, and for change. So what SDI do within informal urban settlements is they support the growth of savings groups, often women's savings groups, bringing women together, drawing on community strengths, and they also do participatory mapping, so working out who lives where, having an address, counting people, counting services, counting resources. Information is power. And on the basis of working with saving groups and doing participatory mapping, negotiating with governments, with service providers to bring health, to bring education, to bring water and sanitation into informal urban settlements where there is a lot of marginality and a lot of need. So to me, this is a really inspiring example of facilitative leadership for dialogue, for voice, for action, and for change. So we've talked about different types of leadership, right? Resourceful and compassionate and resilient leadership in war. Committed and problem-solving and context-specific leadership by community health workers and by carers in households across the world. And also around facilitative leadership for dialogue, negotiation, and change in informal urban settlements. So these models of leadership, I think, are really important. And history shapes how we see leadership. And we're here now in a place that's steeped with history. We've got an exhibition of the Liverpool suffragettes behind us. I don't know if anyone saw it, but Liverpool suffragettes who were beaten, imprisoned, and force-fed in their struggle for women's suffrage. Again, much to teach us about resilience and change. We're also within the Albert Dock, which in itself is a product of slavery and colonialism. And institutions and global health institutions are also shaped by history. And there have been recent calls to decolonize science and decolonize education. And decolonization means to mitigate the disproportionate legacy of European thought in education and in research, in science, and to value diversity and the range of voices and views, and so too in global health leadership. And I wanted to share with you some of these hidden figures that are leading global health, that are working at multiple levels and layers of the health system, are often female, and are too often unrecognized, not valued enough, and not supported enough. Thank you very much.